Why patients should try platelet-rich plasma injections before doing knee replacement surgery or having useless shoulder surgery. PRP is the literal game changer, folks. Hey everybody, I'm Dr. Jeff Williams and I'm the orthopedic specialist with Creekstone Integrated Medical. I want to continue talking with you this week about platelet-rich plasma and why you should give it a long, hard look before going through knee replacement surgery and shoulder surgery. I urge you to share this video with your people. You could actually help them prevent surgery. That's kind of a big deal, right? So think about it. First, what is platelet-rich plasma, also known as PRP? PRP uses the patient's own blood cells to accelerate healing in a specific area, a shoulder, a knee, a hip, a low back, for example. Platelets are a type of blood cell that plays a vital role in healing and tissue repair. So how does PRP work? Well, it contains high levels of growth factors and other proteins that are essential for healing. When PRP is introduced into the knee, for example, it helps to reduce inflammation, promote tissue regeneration, and lubricate the joint. This can all lead to a significant improvement in pain, function, and range of motion. PRP injections can offer a number of benefits for patients who are considering knee replacement surgery. Some of these benefits include reduced pain and inflammation. PRP can help reduce that inflammation, reduce the pain in that knee joint. This can lead to improved function and an improved quality of life. When a patient is moving, their joints just naturally get better and they move more when they feel better, right? That's PRP. Delay or eliminate the need for surgery. PRP can absolutely do that in many patients. And this can give patients the opportunity to enjoy their active lifestyle and avoid the risks and complications associated with surgery. And let's be honest, who's really in a hurry to get surgery? Not this guy. Non-surgical procedure. PRP is a non-surgical procedure, meaning that there's no downtime, no recovery time involved. Patients go right back to work or return to their normal activities as soon as they leave the clinic, typically. It's safe and effective. PRP injections are always safe, and the treatment for knee pain and osteoarthritis is straightforward and simple. There's very few risk factors. PRP is made from the patient's own blood, so there's very low risk of allergic reaction. Who is a candidate for PRP injections? Well, PRP injections may be an option for patients with a variety of conditions, knee conditions, shoulder conditions, low back, but in particular, osteoarthritis, meniscal tears, ACL tears, chondral defects, patellar tendonitis, jumper's knee, runner's knee. That's just to name a few stuff there. Now, how do you get started with PRP? Well, if you're interested in learning more about PRP injections, contact Creekstone Integrated Medical at 806-355-3000 and schedule a consultation. Come in and see us. We'll be happy to meet with you. Our experienced provider can assess your individual needs and determine if PRP injections are right for you. If you're considering knee replacement surgery, PRP injections are a safe, effective, and non-surgical way to reduce pain, improve function, and delay or even eliminate the need for surgery. And I want to throw in there that PRP in randomized controlled trials have been put head-to-head versus cortisone. Well, cortisone injections are the most common reasons, is the most common way to inject the knee and to treat the knee right now. And so when you put PRP and cortisone head-to-head, PRP didn't cause as many issues. Cortisone has a reputation for degrading the joint structures, the bone, the cartilage, etc. That's why they only give you 2 or 3, because it'll degrade the joint structures. PRP comes from the patient. It doesn't do that. Plus, they follow people for a year, and PRP had better outcomes. That's a big deal. So I want you to contact Creekstone Integrated Medical today at 806-355-3000 to schedule a consultation. If you're watching on YouTube or social media, I can't encourage you enough to share this video with your people. I promise. It's going to speak to more of them than you know. Knee and shoulder pain is so very, very common, and you could help prevent them from having surgery, 100%. All right, that's it. Until next time, I'm Dr. Jeff Williams, and we'll see you right back here next week.